Local doctors' offices say they are busy this week, but it's kind of a good news, bad news situation.
Yeah, Dr. Frank McGeorge is here to explain what's going around and why everyone who has not received a flu shot yet should consider taking one.
So the bad news is we're seeing high volumes of several contagious illnesses this week, including COVID, strep, and hand, foot, and mouth disease. But the good news is flu cases are still low. So getting a flu shot now will offer you the chance to be protected by the time that they're expected to increase. Here's what's going around where you live.
In Wayne County, Dr. Tiffany Widener at Children's Hospital is seeing kids with strep throat, hand, foot, and mouth disease, and lots of upper respiratory viruses. Dr. Jennifer Stevenson in the ER at Henry Ford Fairlane in Dearborn reports some nasty respiratory viruses too, plus a lot of asthma flare-ups, especially in children. At the CVS Minute Clinics, viral croup tops the list, and cases of pink eye are on the rise. Moving to Oakland County, Dr. Asha Shahjahan at Corewell Health Beaumont in Troy is seeing RSV, flu, and COVID this week. Pediatric nurse practitioner Sarah Rauner reports a number of children with those viruses too, plus other respiratory viruses and sore throats. Clarkson Medical Group reports COVID and hand, foot, and mouth disease. Looking at Washtenaw County, Dr. Brad Uran at Michigan Medicine is still seeing a lot of COVID and upper respiratory infections. He says fall allergies are also causing problems for patients with asthma and COPD. The health department reports flu is circulating at low levels, but there may have been some sporadic flu-related hospitalizations. Finally, in Macomb County, ER Dr. Anthony Joslin at McLaren Macomb is beginning to see more patients with stomach viruses, plus high volumes of upper respiratory viruses. Cases of COVID remain steady, but fall allergies are causing more complications this week. At the CVS Minute Clinics, hand, foot, and mouth disease continues to increase. They're also seeing lots of colds. Flu activity remains very low.
Now, it takes about 2 weeks after you get a flu shot to develop the full level of protection. So now is a great time to get that done for yourself and the rest of your family. In fact, we had our local 4 flu shot clinic this week, and I know lots of people are walking around with a sore arm, but they're happy to have it. Back to you.
All right, thanks, Doc. Now you can read more advice from local doctors about the vaccines they're recommending now, and even tips on picking a safer Halloween costume for your child. Just go to clickondetroit.com and search what's going around.